guidelines for exercising with pain. Okay. So it's inevitable that we're going to have pain at some point in our lives, right? Struggle and pain, two things we can't get away without. Um, Sometimes we have less than others, but something that I hear all the time people say in the clinic, kind of jokingly, but no pain, no gain. I take the fool's errand. If you're gonna just keep working into pain, all you're doing is shutting those muscle function down, like I was just talking about. Um, the only time no pain, no gain works is if you're training for a half marathon or you're trying to get a personal best on like bench pressing or something like that. Yeah, push through that pain. That's important. But if it's just that chronic pain in your back, your hip, your knee, all you're doing is probably just you're not doing yourselves any favors. Um, so a lot of different directions you can go with pain, but I put together just this little summary, and then we'll dive a little deeper. Um, so just kind of when to exercise with pain, what's the pain mean, when to keep pushing, and when to stop, when to maintain. So pain during exercise, if the pain is mild, it's like just a 3 or 4, that's acceptable. So let me back up a little bit. So pain scale, 0 is no pain at all, 10 is the worst thing in the world. Like take me to the ER right now. It's not a great system, but it's a way to at least to kind of get an idea where you're at in pain. If you don't like the numbers, think no pain, minimal, moderate, severe, and then just kind of put yourself in that camp. If you're doing one of these exercises in a program and you're in this high side of moderate, probably need to help. I need to help you find a way to do something different or pick one of the exercises that were a little bit easier, or maybe you're not getting down on your knees, or pick something that's a little bit easier. Um, Pain after exercise. Some discomfort is expected, right? After you do something, go for a long walk, exercise, you're going to have that muscle soreness. That's fine. That's good. That's normal and expected. It's because you used them. But if it's kind of like your symptoms, what do I say? So it should return to baseline within 24 hours. If pain persists or intensifies, reduce the intensity. So yeah, if you don't kind of calm back down for 24 hours, it just means you probably did a little too much that time, irritated everything. So next time, go a little bit less reps, less squat distance or squat depth, less weight, whatever it is, reduce something until you kind of get back to where that pain levels out after 24 hours. Pain the next day. So mild soreness is normal. If pain is moderate to severe or limits movement, scale back, like we just kind of said. When to progress. Progress when the pain is minimal during or after exercise and movement quality improves. So pain keeps getting less or it's staying minimal, keep going. Go more reps, more weight, more depth on the squat, more, reaching higher up if it's shoulder stuff. Do more of a twist on that back. As long as that pain's getting less and less, you move more and more. And then when to regress. Regress if the pain, gets to be a 5 or more during the exercise, or if the next day the pain is significant, then it's time to regress. Okay. Don't just keep pushing through. All you're doing is causing those pains, those muscles just to shut down. Okay. So the rest of the document just kind of goes into a little bit of a deeper dive. I feel like that summary really hits the nail on the head. But this will be here. I'll hit the highlights and it's there for you, just for your reference. Like I said, one way to think about it, a stoplight, green, yellow, red, minimal, moderate, severe. If you're in the green zone, up to a 2, maybe a 3, you're good to go. Keep going. Go through that little bit of soreness, that little bit of pain. Yellow, okay, moderate, manageable, but you can still perform the movements correctly, but you still have awareness of the pain. It's acceptable to continue as long as it doesn't get into significant pain and it doesn't change the way you're moving. Okay. If you're like compensating the way you're moving because of the pain, you should probably back off. If the pain returns to baseline within a reasonable amount of time, so like, get done with the exercises, you feel the pain during 30 minutes later, you're kind of like, oh, it's gone. Then what you did was fine. But red zone, the pain is sharp and intense. If it's significantly limiting movement, then this is a signal you should stop the activity and adjust the intensity or modify the exercise to reduce the strain. Okay. Pain after exercise. Yeah, like I said, it's kind of getting redundant because it's just going deeper on those bullet points above. If it's after mild, it's fine. If it's moderate, you know, if it doesn't get better after 2 days, back off. If it gets better after a day, keep going. Um, and the next day, again, kind of the same, kind of all still the same ideas. Mild soreness should get better. Um, if you're into that moderate range, which is kind of be the tricky zone, probably where a lot of us are. Um, Moderate soreness can occur, but should gradually decrease as the day progresses. If it remains or worsens over time, it's a signal the intensity is too much, too high, maybe re-aggravated things. So just maybe back off a little bit. When to progress? When pain is consistently remains in the green zone, okay? After all the exercises, keep going. If you have full range of motion is achieved without significant discomfort, keep going. Strength and control are improving. Exercises feel easy to complete, keep going. Minimal pain the next day, you're doing great, keep going. You can complete your current exercises with good form, no compensations. You can load it. Intensity is going up, complexity of exercises is going up, and you're not triggering pain, keep going. So when to regress? When pain enters that yellow or red zone, okay? It says 3 plus, maybe even like a 4. Um, think about kind of regressing. The pain the next day increases and does not decrease. Just regress what you're doing in the routines. You're able to perform the movement without proper form, or you're unable to perform the movement with proper form. Time to regress or change, or don't go as deep with like a squat, for example. If you're getting swelling, redness, warmth at the injury area, back off. Symptoms of the original injury are worsening. It got overloaded. Time to back off. So then, just general tips. Having a good warm up before an activity is really good. Active recovery. So that could be light stretching, going for a little bit of a walk, soft tissue work, foam rolling, things like that can be good. And then communication with your coach, me, your therapist, your doctor, things like that. But generally, it's always good to keep going forward. And then it's minimal pain, moderate, kind of weigh it out a little bit, severe. It's time to back off and figure out a new way to do things. So anyway, I hope this is helpful. I'm going to post this stuff into the group. Feel free to use this as some guidelines for the group and hereafter. Okay, so please print these off, keep them, download them to your computer, share them with friends. These are all things that are going to help you out long term. So if you have any questions, comments, post them below. I'm happy to answer them. I'll bring them on Wednesday when we have our Q&A, and we'll see you on the other side. And our next one we're going to talk about is some nutrition. Okay. So look forward to that one. And yeah, you guys have a good one.